The presentation I have prepared for you will discuss 5 steps to cosmetic success. Of course, there are many more of them, but if you incorporate the points I'm about to make, you'll experience a dramatic increase in acceptance for cosmetic cases. First, let's review the 5 obstacles in general dentistry that may be making it difficult for many of you. We have insurance domination of the marketplace, decreasing demand caused by the fluoride effect, corporate entry into the field, prevalence of advertising, and the economic squeeze of the middle class. One solution to overcoming the forces against us is to expand the list of services you offer. But it's not a guarantee if you can't get the traction on the expanded repertoire. Increasing case size results in greater efficiency, better outcomes, and more patient satisfaction, but requires a practiced and repeatable sales system because the cosmetic cases no longer sell themselves. This Yogi Berra saying rings true when applied to the situation for many dentists today. Those in the middle may suffer, and average just isn't good enough anymore. Here are a couple of books that I've found interesting relative to my presentation. Change or Die discusses the difficulties we all face in making the change. Why choose cosmetics as your focus? Well, the baby boomer generation is aging, and every one of them has a less attractive smile than they once did. That means there's a huge open market for cosmetic services. Success depends heavily on sales skills, which any office can acquire with focus and training, but which the profession at large ignores, leaving a big opportunity. A specialty degree involving costly and time-consuming training isn't needed in cosmetics. In fact, most dentists already have the skills necessary to treat most of the cases. The template technique from Smile Vision makes cosmetics predictable for all dentists, or in other words, you don't have to be Michelangelo or Mozart to create great results. Instead, just follow the template technique protocol step by step and you can't miss. Most dentists have become discouraged because the technical courses offered previously didn't pair up sales with technique, but instead focused on technique alone, resulting predictably in poor sales. Finally, the economy is recovering and a high tide floats all boats. 3 reasons why cosmetic dentistry is a challenging sale. Cosmetic dentistry is a big ticket item and has to be paid out of pocket, just like other consumer goods. Cosmetic treatment isn't urgent or necessary for health. It's totally discretionary. It's not a fun purchase like buying a new car or a dream kitchen, and prospects often can't envision the benefits. Unless you show them how they will look, few will have the "I want it" impulse and will reject treatment. So here are some sales basics to keep in mind. Systems for selling. Ad-lib stand-up works well in the comedy world, but not in ours. Case acceptance should be carefully rehearsed and planned. It should be a real system that can be applied again and again. Promotion. Once you have a sales system in place, it's important to advertise effectively. In this presentation, we'll discuss only numbers 1 and 2. I have spoken with many AACD accredited members who are not doing so well in their practice. They have the clinical skills, but not the sales skills needed to close the cases. True worth is determined by how much more is given in value than is taken in payment. Price is only a dollar amount and is elastic when dealing with services. A great service is always worth the price, and if you're discussing per unit fees with patients, you're on the wrong track. So now let's go to step number 1. An effective sales team member is crucial to repeated sales in cosmetic dentistry. That's because the doctor is usually too preoccupied with the technical aspects of case delivery to also devote the time and care necessary to holding the patient's hand in sales. We assume that you will be using ad tracking phone numbers on every ad and on your website too. All incoming calls from ads should be forwarded to the key sales team member's phone or personal line. If the prospect is thought to be a possible candidate for comprehensive dentistry, he or she will be sure to greet prospects on the first visit, host an office tour, and chat with them in order to gather more information about their dental wants and needs. At the introduction, the key team person relates what he or she has learned about the patient and asks the patient for confirmation. After the initial meet and greet appointment, the key team member will escort the patient from the dental chair and make up the next appointment for the complete oral physical. The sales team member is the prospect's connection to the practice. He or she should be in there every step of the way to collect information and facilitate the sale. In smaller practices, the sales team member may have other duties too, but time and priority should always be allotted to his or her duties in sales. The sales team member should be rewarded independently over other employees for success by a bonus plan linked to sales success. In some offices, the sales team member could work part-time and sometimes from home, taking incoming calls on a cell phone and showing up at the office when big case prospects are scheduled. Poll your current team to see if someone currently on the team would be right for the job. If you don't have someone to fill the bill and see the need to fill that position, here's an ad that when placed in Craigslist will get you the person you are looking for. So here's the ad from Craigslist that's worked well for many people. Everyone, of course, will have a little different text, but here we're advertising for a key sales team person. Notice that I've said here, and this is what I recommend, they're not necessarily experienced in dentistry. Hours are flexible. Sales skills and experience are important. But so this isn't for a dental person, it's for a dental sales person. They can learn the dentistry pretty quickly usually. It's more a matter of having that interpersonal relationship with people. What I do want to point out, though, is this Craigslist ad comes with an application. And I think that's really important. Otherwise, you're going to get swamped with meaningless resumes. The application, in this case, asks some important questions. Put this in, how much do you want to start with? But how much do you want to make in a year from now? Because you want somebody who wants to make a lot of money. I mean, relatively speaking, you don't want somebody who's happy with a very low wage because they're not the person who's going to excel at this kind of job. And then, of course, your experiences, what experiences have they had? And you'll notice right at the top of the list, sales, influencing others, caring for others. If they've sat and done dental assisting for 5 years, that may or may not be really crucial. And of course, you're going to evaluate, and here's some other questions, and you're going to evaluate this when it comes back with their resume. And that'll drastically cut down the number of responses you get to the ad. But the people who will take the time to do this and fill it out are serious, and then you can evaluate much, much better, and you'll be a leg up so that usually you can call in 3 people and select one. So this kind of an ad with an application is what I recommend. So let's move on to step number 2. If you do what everyone else does, you'll get what they get, very little in the way of cosmetic cases. You need to tell people why you are different from your colleagues and the one to choose for certain procedures, yet stay within the bounds of good taste and the law. Keep it simple. Don't try to be everything to everyone. Don't make your services like this menu. The Big and Outrageous Packet is one way to get the word out to prospects who have contacted your office. Here's an example of a B&O packet made up by one of our clients. It clearly tells what he does. Here's some testimonials about the doctor, before and after cases, testimonials from other professionals. See, I'm even in there. Fee ranges. He's not afraid to talk about money. Suggestions about how to pay for the dental work. The same ideas can be applied to a website. There's no doubt about exactly what this doctor is promoting. Some dentists have 2, 3, or more sites, each for a different niche, cosmetics being one of them. Now let's discuss setting up a cosmetic practice within your current practice. That way you can keep as much or as little of your general practice as you like, while your cosmetic practice flourishes. Cosmetic cases must be sold, as is true with any other luxury product or service. The sale of high-ticket cosmetic cases requires a mindset different from routine dentistry. Much more time and attention needs to be paid to the patient. Every office will put the red line at a different level. Some will set it lower, while for others it could be much higher. What's important is to set a line separating prospects who have more costly needs from the more routine cases. Patients with needs above the red line will need to be treated with extra TLC and be slipped into the sales system for larger cases. There are several options here. You can treat routine cases in your general practice, assign them to an associate, or refer them out. It all depends on how much you want to keep the more routine cases in your practice. What is important is to preserve time to work on your sales system with your team each week. Don't allow yourself to become so busy with the small stuff that there's no time to think. Qualifying prospects is important because not everyone has the need, desire, and funds to benefit from extensive dental services. It's important to determine early on who is and who is not a candidate for such services. That will save time and avoid the frustration and bad feelings caused by trying to sell services that people don't really want. The earlier in the sales process you learn if a prospect is qualified or not for cosmetic treatment, the better for all concerned. That way everyone gets what they want. Getting the information needed to qualify prospects for cosmetic procedures starts with the first phone call, but doesn't end until the sale is made and the case is started. The more you know about your patient, the better. Time consumed in dental care is sometimes as large a barrier to treatment as is money. Include both in your framing conversation. The complete oral physical is the point where you will ask your patient to step forward, to put up some money, and qualify himself. Patients who don't want to go forward with the complete oral physical should be considered general dentistry patients and treated accordingly. Create the want for your presentation. Few patients can envision how they would look with an improved smile. Give them something to see with professional quality, clinically accurate, individually drawn cosmetic simulations from Smile Vision. Buyers respond to an emotional appeal. The sales team member could offer a simulation at the initial visit for free or even charge a fee as the first qualification step. and then show the simulation on the SmileVision site as a slideshow. This would require 1-hour service available from SmileVision. As an alternative, you could take the picture at the first visit and send the simulation to the patient's home digitally via email and as prints via the postal service. In such a case, wait until the next visit to discuss the complete oral physical. There's no rush. Patients rarely make a decision to move forward on the spot. As a note of caution, inserting teeth from a tooth bank into the simulation destroys landmarks. The lab needs to create temps that follow the plan created in the simulation. Simulations from SmileVision are hand-drawn, clinically accurate, and are the first phase of SmileVision's template technique protocol. Let the SmileVision lab turn the simulation into temps that follow the plan every time. Contact me to discuss this in more detail. Print your own simulations or let SmileVision do it for you. Either way, prints allow patients to solicit reinforcement from family and friends. As an additional benefit, the simulations serve as a statement to all who see it. The simulation says that you are different from other dentists and that you have the tools and interest to treat cosmetic cases correctly. Cosmetic simulations are probably the best investment in advertising you can make. This part of the sales process should be assigned to the team salesperson. The complete oral physical consists of 2 parts, both intended to collect information about the patient which will be used in the case presentation. The presentation visit is best spaced about a week following the complete oral physical. Make sure the patient doesn't come alone to that visit. Never use an itemized list for larger cosmetic cases because it invites commoditization. Instead, bundle all procedures together and give a fee for each treatment option presented. The case report should be jargon-free and written in language that an average 8th grade student could understand. Remember, a confused person doesn't buy. These are the people who should be in the room when the case report is presented. The doctor's presentation should last no more than 20 minutes, and he or she should stop frequently to ask, "Do you understand? Do you have any questions?" Many sales experts and consultants recommend that men wear a blue suit when selling to subtly command authority. Ladies should be dressed and coiffed appropriately. Everyone in the office should have a great-looking smile, and the office reception area should be neat and up-to-date. In most cases, 3 treatment options are recommended and presented, starting from the most costly and complex to the least. So here we have a typical case presentation. We start out here with a cosmetic simulation to make sure the patient sees how they look now versus how they could look. The next topic is, what have you told me about your problems? Now, this has to be collected beginning at the first phone call, and this is the task of the sales team person to be able to collect this information at the initial visit, on the phone, and at the complete oral physical as well. And your dental problems have caused you the following. Again, information that was collected at the previous visits. That's why that's so important. Now the things that the doctor recommends regarding your teeth. These presentations should be laced with simple, easy to understand pictures to show examples. And here we have, for example, a mouth that's all full of fillings and then the same mouth looking better. It could do it with dentures, certainly could do it with cosmetics. Joints and ligaments and chewing muscles, how are they affected? And now finally, what is it the doctor plans to do for you, can offer you? And typically there are 3 options: the very best option, a middle option, and a least option. And You should present those from the most complex to the least complex, taking away each time some of the value. Of course, what happens if you do nothing? Cost and amount of time and care. What will happen if you don't do anything? And then, of course, we've added on your responsibilities, what you have to do to maintain this. What are you promising for a warranty? And finally, a signature to show that the patient has seen it. Give the patient and financial other the opportunity to ask questions after describing each option. The doctor then states the fees for each option and makes an effort to get the patient to express an option preference prior to leaving the room. This should all take no more than 20 minutes. It's up to the sales team member to make the financial arrangements and schedule the case. As a review, here are the 5 steps I have presented to help you integrate cosmetic procedures into your practice on a regular basis. Remember, nothing happens until you take action.